The medical care for the aged bill was defeated in the United States Senate. A switch of 2 votes in the Senate would have provided, I believe, for its passage. I believe this is a most serious defeat for every American family, for the 17 million Americans who are over 65, whose means of support, whose livelihood is certainly lessened over what it was in their working days, who are more inclined to be ill, who will more likely be in hospitals, who are less able to pay their bills. I think they've suffered a serious setback today. But this issue is not confined to them. All those Americans who have parents who are liable to be ill and who have children to educate at the same time, mothers and fathers in their 30s and 40s, I believe they've suffered a serious setback. In 1960, with Senator Anderson, I introduced the medical care for the aged. A change of 4 votes in the Senate in 1960 would have provided for its passage. This year we came closer. I think the American people are going to make a decision in November as to whether they want this bill, similar bills, to be passed, or whether they want it to be defeated. Nearly all the Republicans and a handful of Democrats joined with them to give us today's setback. The election in 1960 was very close. It has meant that nearly every vote in the House and Senate is close. Some we win by 1 or 2 votes, others we lose. We have to decide, the United States in 1962 in November in the Congressional elections, whether we want to stand still or whether we want to support this kind of legislation for the benefit of the people. You are going to have a chance to make that judgment. I hope that we will return in November a Congress that will support a program like medical care for the aged, a program which has been fought by the American Medical Association and successfully defeated. This bill will be introduced in January 1963. I hope it will pass. With your support in November, this bill will pass in 1963.